Thank you, John, for that warm welcome, and good morning to everyone. I'm delighted to be here today to talk about some things that I'm very passionate about and are of great interest to me, and I'm sure they are to all of you here. I think when we talk about the psychological impact of cancer, we recognise a number of things. It's hard to ignore that it doesn't have an impact on both the patient and the family. But often our experiences of cancer may not have come to us directly, and we may have some myths and misconceptions about what a diagnosis of cancer may mean. This is particularly pertinent because the nature of cancer and its treatments are actually changing quite significantly. For many people, you may actually be living with a condition that is no longer considered incurable. And I think that's one of the messages that we need to take home today, that whilst cancer can be seen as a very negative thing, we are talking about a disease that is curable. And there aren't many medical conditions that we can talk about that. And even for those whose disease is not amenable to cure, where previously we might have thought that that meant a very short prognosis, cancer is increasingly becoming a chronic disease where individuals live with their condition, being able to maintain a very high level of function. One of the things that's really impacting on the psychological impact of cancer, both for the individual and their family, is the changes to healthcare delivery. Increasingly, we're finding cancer patients will receive the majority of their patient care as an outpatient. And this means that the burden of care and supporting the individual with cancer is increasingly falling to family members, the community, and close social networks. I think it is critical that we recognise that the significant psychological impact on the individual and their family. If we're to provide good care, we need to address those aspects of their care. I think one of the things we tend to do when we present in forums like this is we present what we know based on evidence. And that's an amalgamation of information that we've gathered, and we generalise it to a certain extent. What we have to be mindful of, though, is that each individual's experience of cancer is their own, and each person will experience their diagnosis and their treatment and their recovery from cancer in their own unique way. So if today we talk about things that may or may not have been part of your experience, don't feel that you aren't fitting the norm, because the norm is actually incredibly broad. Your experience of cancer, or a family member's cancer, will be experienced by a number of factors. And personal experience of having friends or other contacts, work colleagues, having had a cancer diagnosis, can make you think that certain things might or might not happen. What's important for us as health professionals when we're looking after someone with cancer is that we recognise that cancer does not occur in a vacuum. That is, a diagnosis of cancer and undergoing the treatment for cancer is not the only thing that's happening in your lives at that particular time. And it's very important that you remind us as consumers other things that are happening, that you still have to maintain your livelihood, that you manage a family and are active members of the community. What we recognise, and I think this is particularly pertinent for rural areas, is that a cancer diagnosis can have a significant ripple effect. It doesn't just impact on the individual and their family, but in small communities can have a very large impact on that community at large. It may be a workplace, it may be a school that's impacted. And so when we're talking about cancer, we need to think about that broader social context. When we're talking about psychosocial needs in relation to cancer, one of the things people ask me, well, is it really different in rural areas? Surely the issues are the same, regardless wherever someone's living. There is some important things that are different and unique, and some of those things are very positive things about being in a rural area. And they're to do with the social context of rural areas. Certainly, one of the really positive things about experiencing a cancer diagnosis in a rural Australia is that there is obviously a long-standing history of increased community engagement. This often means that there's increased access to social support and networks that can have a sense of knowing the individual, knowing the family, and know how to provide practical support. I know from my own experience of growing up in a rural area that it's not uncommon that if you've got someone like my dad, who was a farmer, who was unwell during harvest time, that all the locals came and helped us do the wheat harvest. That's the sort of thing that is a real positive in relation to living in a rural area. There's a sense of belonging to a community, which is very sustaining at a time of crisis in your lives. And in many ways, you're not being cared for by strangers. The person that comes to care for you if you're requiring assistance in the home is someone that may be known to you, or if you don't know them, you probably know their parents. The other thing about rural areas that's a real strength is that because we don't normally have access to all the things that may be available in the city, there is often very creative approaches that develop in providing support. All of these things are real strengths, as is a rural culture. We often talk in Australia about, our ruralness, and I think people ask, really, in the 21st century, is there such a thing as a rural culture? But we know that there is, and it does very much impact on how someone may experience a cancer diagnosis and their treatment. And one of the main concerns that raises for us as healthcare professionals is that there is often a reluctance to actually ask for help, particularly around psychosocial and practical areas. And I highlight that as something for you to think about. The other things that are important for us as health professionals, particularly looking at how do we provide help in this area, is some very important social context issues in relation to that we know that financial resources are more limited, that the population tends to be older, which means that you have a limited access to some of the more additional support services, and there is an ageing volunteer community services. And many rural communities function basically on a volunteer service. As that service ages, their ability to provide that service can be decreasing. In addition to the sort of practical areas, the financial dependence on industry with fluctuating productivity in markets can have a very big impact on a rural community overall, as well as to individuals. And I guess I'm representative of very much the sort of growing trend in relation to rural Australia. I'm one of 7 children, and all 7 of us have moved away from the rural area that we grew up in to find work, employment. So for my parents, like many people that live in rural areas, our extended family is actually living a long way away, and that reduces and removes access to a very important social resource at a time of a cancer diagnosis. So what do we know about the support needs of people in rural areas? And some of this is probably not going to be very new to you. One of the things that we've identified from research is that access to after-hours support is a real challenge, and obviously that's not something that's easy to address, so there are some models that have been developed to do that. Certainly we know that the things that make an experience of cancer more difficult is access to information and support. If you can't get the information you need at the time you need, then it doesn't actually help to reduce your stress and anxiety at that time. So how we find and create mechanisms for providing information is really important, and that's why the numbers that are listed on the back of your program here are very important for you to become familiar with, because they are a central point that you can go to, and they can also guide you to the resources locally in your area. One of the downsides of living in a rural area is that you do know everyone, so there can be issues around privacy. You may very well know the person who provides that service extremely well. That may not mean that you actually want them to be engaged in your cancer care, and that can be a very challenging and difficult situation for rural people. That's where it's important to be open and honest about that experience that you're having, and to help get that individual to help you to find the support that you need. What we have found when we've looked at this area, and there are a number of people that will be speaking about this today, is that there is enormous variation in the services that are available for people across rural Australia. And some areas are actually well serviced, whereas others have significant problems. And then there are the issues around travel and accommodation, which we won't be spending a lot of time on today. I'd like to talk about the emotional impact of cancer. I think it's well recognised that it's a very frightening experience, and as I said, will be influenced by past experiences, access to support and information. The sorts of things that we know that people are frightened of is what the treatment means, and that's very much influenced by the fact if you've had someone who come back to your community that had chemotherapy and had a terrible time, that you'll think that that's probably what's going to happen to you. But that may not be the case, and that's why information is really important. Frightened about the side effects and how you're actually going to manage them. But we find many cancer patients worry the most about what the impact's going to be on those around them. And we found from the research that we've done that the best support we can often do for a cancer patient is to provide support for family members. People worry about dying of cancer because that's the meta message that gets out there. It's the big message. But as I said, it's a very curable disease, and it's one of the diseases we're making great inroads in relation to improving survival. dealing with any of the things that I've listed above are difficult for anyone, but dealing with them in an isolated community or isolated within a community can make it particularly difficult. And in many ways, I would encourage people to think about where they could go to and to take that first step to seek assistance. This is a quote from one of the participants that we interviewed in a study who talked about what it was like after having a diagnosis of cancer, where he says, "It's an ongoing lump in my stomach. It never really goes away, waiting to see if it's going to come back." The sorts of things that we know are problematic and that your healthcare professionals will be looking out for, but you should feel free to raise with them when you're seeing them, that we know can be an issue, are anxiety. Anxiety can be about lots of things. It's not just about the cancer and its treatments. It can be worried about the bills, be worried about how you're going to continue to provide support to your elderly mother. You might be worried about children and how they're dealing with it. Cancer does have an impact on body image, and I'll focus a little bit more on that in a minute. Coping with the physical symptoms, depression, emotional disturbances, and we know that there is issues around stress. We live in a stressful society to start off with. A cancer diagnosis can certainly add to that. There are a couple of time points that I'd like to just briefly touch on, where we know that people can experience increased emotional concerns. Often the completion of treatment is seen as a time of celebration for family members and carers, because it's like, great, we've got through that. Cancer's now finished in our lives. You're off treatment. We can get back to normal. But for the individual with cancer, often that's the time when, to a certain extent, the reality of the diagnosis starts to really hit home. You've been very busy dealing with the treatment, managing the travel, up until that time point, and now there's often a bit of quietness, less access to health professionals. Some of the family support might start to drift away as they think that everything's okay, and it can be a very challenging and difficult time. And for family members, they kind of sometimes think, I can't work out what's going on. You're not having chemotherapy anymore. You should be getting better. A recognition that, yes, whilst there is a return to normality is very different. And there is a time of adjustment that many people experience about as they go through a process of redefining what their new normal life is about. We certainly know that a very small percentage of cancer patients will experience quite a significant psychological distress that we call post-traumatic shock syndrome. It's a very small percentage, but for anyone that's having ongoing problems at this time, we'd really encourage them to speak to their general practitioner about that and seek some specialist help. Living post a diagnosis of having been treated for cancer is something that people recognise is not that straightforward. We know that after a diagnosis, even for a couple of years, people have an ongoing fear about recurrence, about the cancer coming back. Even though we like to say to people, if you get a certain time period, we're fairly confident, it's always there in the back of people's mind. Often the time when you go back for checkups is the time where people feel very much increased anxiety. Little aches and pains that you may not normally have worried about suddenly take on new meaning and become a cause for anxiety. If you're anxious, seek advice from your general practitioner is the most important thing. It's much better to go and have your fears allayed and to discuss them than to stay at home worrying about what that pain in your hip might be. You have to remember that unfortunately most of us are ageing and we do have lots of other things that can go wrong, and it may not actually be your cancer that's causing the problems. The impact on career, employment, life insurance and superannuation can be quite significant, and these can be major challenges. And Kim will be talking a little bit more about that and providing some information where you can get some additional information and support in that area. But we recognise that this is probably an area that we haven't focused on a lot from the healthcare professional's point of view. And there are long-term impacts of treatment, and certainly as we're seeing increasingly fertility issues, and as we get better at curing people, the survivorship issues, as they're broadly called by consumers, are becoming much more of an issue that we need to deal with. I'd like to just in the final few minutes briefly touch on these very important personal issues. When you're diagnosed with cancer, it's kind of hard not to just focus on things like, how am I going to get through this? Am I going to live with this condition? Does it mean that I'm going to die? For many people, they do really well, and they'll undergo some treatments which may or may not have an impact on their body image, on their sexuality and their sexual function. It's kind of hard to worry and feel that it's valid to worry about these things when you're dealing with a major life-threatening illness. It's kind of hard to say, well, that's great, you're going to give me some chemotherapy, but it's going to make my hair fall out, or it might make me infertile. You know, should I actually consider it? They're very valid questions and concerns to have. It may not change your decision to have treatment, but it is important that you discuss those concerns. What I found in talking to people that have had a cancer diagnosis is they feel very reluctant to raise concerns around body image and sexuality for fear that they're not important at this time when they're dealing with life-threatening illness, or for fear that their concerns will be dismissed. We know that there's a bit of stereotyping that we all do as members of society about who should be worried about body image, and the sense that it's something for the young and not for the middle-aged and the elderly. Yet it's an important part of who we all are. So often cancer patients have described to me that in fact their body image, their sexuality, their sexual function at a time of crisis in their lives can actually become important because it's the way they maintain their relationship and maintain intimacy with their partner. It's a form of communication, and that's a very valid and effective and important thing to do. We certainly seek human contact at a time of crisis. It's natural. It's very reassuring and comforting for us. If we don't address issues around body image and sexuality and sexual function, we know that in a small percentage of people it can put an increased burden on relationships, and it certainly has an impact on an individual's psychological well-being. It's kind of how we feel about ourselves, and that's why it's really important to address it. It's integral to valuing and recognising the person as an individual. So what is it that you would actually do in addressing these concerns? Because I think some of the reasons why people don't raise them is there's a sense that there's nothing you can do about it. In actual fact, we know that there are a lot of very simple things that we can do to help people around this. Often there's a sense that body image and sexuality only become an issue if you've lost something that is a significant area related to it. So, for example, if a woman's lost a breast with a mastectomy, or a man has had a prostatectomy, that these are the things where you would think about it. But there are lots of things that people can experience as part of their treatment that can have an impact on their ability to maintain intimacy. For example, it's really hard to kiss if you've got a dry mouth. So if you've had radiotherapy that's involved your head and neck area, or your treatment is causing a dry mouth, it's a part of your relationships that you may find more difficult. And there are things that you can do about that and seek advice from those that are providing that care. Sometimes you have treatments that mean that you're quite fatigued. It's kind of hard to feel like being intimate when you're feeling really exhausted. And I know it's one of the things that cancer patients on chemotherapy frequently say, it's the last thing possible on my mind at this time. And they worry that it might be on their partner's mind, and therefore it's not actually something that they're maintaining as part of their relationship. In relation to that, there are some really interesting things that you can do. Interesting sounds good, doesn't it? Makes it sound very good. But there are some things that people can give you advice about. One of the things that I'd strongly encourage you to do is to maintain physical contact. It's about hugging and closeness. Certainly we know that sometimes people find difficulties in the positions that they may have found useful before, and there is some advice that you can get around that. And it makes me sound like I do nothing else but give people advice about how to have sex, but that it is much more than that. I think it's important to recognise that there are lots of subtle little things that can make a difference, both negative and positive. And there are lots of things that we can do to help people, both by providing advice to the individual, but also speaking with couples. Simple things like providing advice about how to manage vaginal dryness, which some women may experience when they experience a premature menopause associated with their chemotherapy if they haven't been through menopause yet. So what helps? Well, we know that emotional support is really critical. It makes a major difference in people's outcomes in relation to psychosocial care, how they adjust to their cancer diagnosis and recover. So thinking about who is there to talk to in your area. Your general practitioner is very important. They may not be the person that you think you can always talk to about some of these things, but they'll know who's there and they can make a referral. They may be reluctant to raise these issues with you, but they won't be reluctant to have you raise them with them. And I know that in some ways puts the burden back on you, but it is important to think about what the issues are for you, to write them down on a piece of paper, make an appointment and go in and say, hey, look, I'm having a bit of a problem in this area. Could we talk about it, or could you tell me who I could go to? community nurses, social workers, and it may even be your local minister who's the person that you find most comfortable to talk about. It may be a close girlfriend, or it might be the volunteer cancer support service in your area. If you immediately can't think or find someone, then the cancer helplines are very important. Think about what the information is that you need. Often when you've got a problem, it's easy to focus on what the problem is, but what is the information you need that would help you to address the problem is critical. And that's one of the things I'd encourage you to think about. Listening is important. One of the things that we often need to do is teach family and friends that what you need as a cancer patient is someone to listen. And you also sometimes need to teach health professionals that, because it's our natural response that when someone identifies that they've got a problem or a concern is that we want to rush in and actually fix that problem. And maybe the problem doesn't need to be fixed. What you need to be done is actually heard. So to the carers out there, what I'd encourage you to do is actually give your family member that has cancer an opportunity to talk about their concerns and to listen to those concerns, because it's the talking about that makes a difference. Write down questions when you're going to see someone is really important. And what we know and why we recommend that type of referral is that when we tailor what we're doing to the individual's needs, we're more likely to get a really good outcome for everybody. And think about support groups, either for you or your family. So what can you do? Get information, talk about your concerns, but most importantly, do not suffer in silence. Use the things that you've done in the past at times of crisis. What's helped you through things before? How did you manage a situation when it wasn't going well? Think about the things that worked well and think about what didn't work well, and don't use those ones again. Seek specialist advice if the concern is not resolved. But remember, there is always something that can be done, and there's always someone there that can help you. In closing, what I'd like to suggest is that while things may get done a little bit differently in rural areas, they still get done. Thank you.
Thank you very much, Kate, for an excellent presentation. You've touched on a lot of issues that I would like to come back to during question time. The tension between, I guess, having that support in the community and how do you maintain your privacy comes to mind. The 7 kids leaving the rural location, but I guess there's somewhere in Sydney if they need to come to Sydney, but hopefully the care can be done in the community. The post-traumatic stress syndrome is a real issue that some of us as doctors often overlook when someone's not sleeping well or tired or depressed after their treatment. And I think we'll touch on that later, and also the communication between the carer and the person with cancer and listening. So thank you very much. If you have any questions for Kate, please write them on your question form, and just people here, put them to the end of the row and we'll pick them up, or the others in the rural locations, just give them to your coordinator and they'll fax them through and telephone them through. Our next speaker is Miss Kim Hobbs, who works here at Westmead. She's a social worker. Kim is a well-recognised expert in gynaecological oncology. She works very closely with people living with cancer, their families and their carers, often working with people visiting Westmead from the country. Kim is regularly involved in cancer-related research, and Kim's topic today is practical issues of living with cancer. Thank you, Kim.